Hi, Dr. Tuck here with Tuck Pulmonary. I want to talk to you for a few minutes about quitting smoking. Now, smoking is really bad for you, but most people know that. I'm doing this video to help you quit. The first step in quitting smoking is to want to quit smoking. I say want to because a lot of people, they're not even at the point where they want to quit smoking. They enjoy smoking. They enjoy smoking with their friends. They enjoy the situations that they're in when they do smoke. They don't want to quit smoking yet, even though they know it's bad for you. So you got to want to. Once you get that in your mind, that it's really bad for you and that you need to quit smoking, most people do get into that point where they do want to. Now, people have been quitting smoking for a long time, like the way they've been quitting other things that they know they shouldn't be doing. Sometimes they white knuckle it, sometimes they wean it over time, and that works with varying degrees of success. What we found, though, is that the chances of quitting smoking increase if you use a pharmacologic or medication-based strategy as well. So basically, there are three medication types that we can use: nicotine replacement, Chantix, or Wellbutrin, also known as Zyban. I usually recommend the nicotine replacement as a first line because I figure you're already getting the nicotine in the cigarettes, so why not just give you the nicotine in a different, safer form to help you wean off of it? People do have side effects from that, but they seem to be less common. If you're smoking more than 10 cigarettes a day, I recommend that you start out with the high-dose patches. If you're smoking between 5 and 10 cigarettes a day, I recommend you start out with the medium-dose patches. If you're smoking less than 5 cigarettes a day, I wouldn't even muck around with the patches. Now, I also recommend that people use an additional form of nicotine if they're using the patches. That is nicotine gum, nicotine cough drop. And the reason is because the patches put a little bit of nicotine in your bloodstream, but it's not as much as an actual cigarette. So you'll probably still get some urges. That's where it's useful to have something that you can use, like nicotine gum, nicotine cough drop. The nicotine gum, I find some people do have trouble with it, and usually the trouble is that they get like too much of the flavor at once, so it makes them feel sick or it gives them heartburn. Part of the reason is because a lot of people pop that gum in their mouth and they chew it like a little kid chewing bubble gum, and they get all that nicotine at once or all that flavoring at once. I don't think you should chew it like a little kid chewing gum. I think what you do is bite it till you can taste it, then park it on the inside of your cheek. Once the flavor goes away, bring it back out, chew it a few more times. When the flavor comes back, that means the nicotine is leaking out again. Park it again. Cough drops work in a similar manner, the nicotine cough drops. So again, I recommend the nicotine patches and then something else you can use to give yourself a boost. The patches are pretty cheap usually, especially if you use the 1-800-QUIT-NOW line. It's harder to get the other nicotine forms paid for, but in the long run, you're going to save money because you're not paying for cigarettes. There's also nicotine nasal spray. There's a nicotine inhaler. Any of those things are potentially helpful. Chantix is a medication that's also helpful to quit smoking. The biggest side effect I hear about, and the side effect that they make a big deal of in the commercials, is the nightmares. I have had people had to quit using Chantix because of the weird dreams, but most people can take it fine. You can stay on Chantix for a long time. The way it works is it basically makes the cigarettes less satisfying, so it makes it a whole lot easier to wean down and quit. There's an antidepressant called Wellbutrin. I think the way it started getting used to quit smoking is that people were taking it for depression and they were having that side effect of getting off the cigarettes. So now we use it to help people quit smoking cigarettes whether they're depressed or not. It definitely helps. It's got some mild side effects, potentially, but those are typically minor side effects, and if you're having them, you can simply stop the medication and contact your doctor's office. Now, quick word about vaping or electronic cigarettes. I can't in good conscience recommend those. It's possible that they help people get off the cigarettes. It's likely that for most people, the cigarettes are much more harmful than the vaping or the electronic cigarettes ever would be, but it does look like there are some rare instances of people having severe lung injury from smoking the vapes and the electronic cigarettes, and I'm not talking about over years, I'm talking about over just a few days. So, I can't in good conscience recommend them. Please avoid those. If any of these things are helpful, I would love it if you left a comment. Please consider subscribing, and if you have any desire to stop smoking cigarettes, talk to your doctor about how these strategies might play a role. Thanks so much.